Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Occipitalis. And here at the side you can see the diagrammatic representation of Norma Occipitalis for the reference. So let's start our topic with introduction. Norma Occipitalis presents the back view of skull, revealing the occipital bone and adjacent regions. It emphasizes the rounded curvature of cranium, key structures, muscle attachment, and part involved in neck articulation. Now let's talk about what are the bones visible in the normal front occipitalis. This view includes portion of the following bones: occipital bone, that is dominant feature of the view. It forms the lower posterior part of the cranium. Second is parietal bone is visible from the norma occipitalis. It is seen on either side above the occipital bone. As you can see here in the diagram, the purple color bone is the parietal bone and the blue color bone is occipital bone. It joins the occipital bone at the lambdoid suture. Next is temporal bone, that is mastoid part of temporal bone is visible. As you can see in diagram, the green color area is the temporal bone, mastoid part. It is present on the lateral side with visible mastoid process. Now let's talk about key features that are visible from the norma occipitalis. First is external occipital protuberance, as you can see here in the diagram. It is a palpable bump, also called as inion, at the midline of the occipital bone. It serves as an attachment for the nuchal ligament. Next, we can see the nuchal lines. They are superior nuchal lines that extend laterally from the protuberance attachment side for muscle, and they are like trapezius. Occasionally, there are inferior nuchal line that is always also present that may be visible lower on the bone. Further in key feature we have is lambdoid suture, that is zigzag joint connecting the occipital bone and parietal bone. They may feature small extra bones that are called as sutural bone or Wormian bones. Next is mastoid process, that is rounded projection of temporal bone located just behind the ear, as you can see here in the diagram. It provides anchor point for neck muscles. Now let's talk about clinical and functional significance of norma occipitalis. First is palpation landmark. It is palpation landmark for neuroanatomy, physical therapy, and surgical orientation. It is important for assessing cranial symmetry in development and traumatic evaluations. Its external occipital protuberance and nuchal lines are key markers for muscle attachment and postural balance. Now let's talk about muscle attachment of norma occipitalis. Several muscles of neck and back attach to the structure seen in this view. They include trapezius muscle, sternocleidomastoid muscle, splenius capitis muscle, semispinalis capitis muscle, and these muscles contribute to the head movement, postural support, and scalp tension. Now let's talk about conclusion of this lecture video. Norma occipitalis may look deceptively simple, but it is located with structural significance, from the stitches that bind the skull to the ridges that are thermititis muscles. It gives us a rear window perspective into the skull protective strength and mechanical function. And this was all about norma occipitalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.